Welcome to Medigap TV. Real answers about Medicare in plain English. Hi, I'm Loran Marms, and I've been a licensed Medicare specialist for 16 years, working with clients in 46 states. Today's video is specifically for people who are still working when they turn 65, because this is one of the most misunderstood situations in all of Medicare, and the mistakes people make here can follow them for the rest of their life. Most people assume that if they have insurance through work, everything is fine and they don't need to worry about Medicare yet. And that's partly true, but it depends on some very specific factors that a lot of people, and honestly, a lot of HR departments don't fully understand. So in this video, we're going to cover the key rule that determines everything, what you can and can't delay, the 5 most common mistakes I see from people in this situation, and what you need to do to protect yourself. Let's get into it. The single most important factor when you're still working at 65 is the size of your employer. Specifically, how many employees your company has. If your employer has 20 or more employees, then your employer's group health plan is considered the primary payer, which means your insurance through work pays your claims first and Medicare stays secondary. In that situation, you have the option to delay Medicare without any penalty, as long as you handle it correctly. If your employer has fewer than 20 employees, the rules flip completely. Medicare becomes primary and your work plan becomes secondary. In that situation, if you don't enroll in Medicare at 65, you can end up with serious gaps in coverage and a permanent penalty on top of it. And this same rule applies whether the coverage comes from your own employer or a spouse's employer. If you're covered under your spouse's group plan, the 20 employee threshold still applies, and you need to know how many people work for your spouse's company. If your employer has 20 or more employees, here's how Medicare works for you. Part A, which is your hospital coverage, is free for most people who have worked and paid Medicare taxes for at least 10 years. You can go ahead and sign up for Part A at 65, even while you're still working. It costs you nothing, and it works alongside your employer plan. There's no reason to delay Part A. Part B is where the decision comes in. Part B covers your doctor visits and outpatient care, and it costs $202.90 a month in 2026. Since your employer coverage is primary and fully active, you are allowed to delay Part B without any penalty. A lot of people do that to avoid paying that premium while they're still covered at work. That's a legitimate choice. For Part D, your employer's group plan provider mails you the notice of credible coverage each September. That notice tells you whether your drug plan meets the Medicare standard. Keep it. As long as it says your coverage is creditable, you're protected and there's nothing else you need to do on the drug side. Now, here's something I want to say before you just automatically decide to stay on the group plan. Before you make that decision, give us a call. I can compare your group plan's monthly premium, your annual deductible, and your maximum out of pocket against what Medicare plus a supplement would cost you. Sometimes your group plan wins. Sometimes Medicare is actually cheaper and gives you better coverage than what you're paying for at work. You don't know until you compare the numbers, and that's exactly the kind of comparison we do for people every day. The number is 920-545-4884. If your employer has fewer than 20 employees, the situation is different and more urgent. When your employer is that small, Medicare becomes your primary insurance at 65, even if you're still working and still enrolled in the company health plan. That means Medicare processes your claims first. Your work plan only pays after Medicare pays, and in many cases, it only covers what it specifically offers, not what Medicare left unpaid. If you don't enroll in Medicare in that situation, here's what happens. Your claims go to your employer's insurance first, but because Medicare was supposed to pay first and you didn't sign up, your employer's plan may deny or reduce those claims. You could end up personally responsible for a large portion of your medical bills. If your employer has fewer than 20 employees, the right move is to call us. We can confirm exactly how your situation works and get you set up with Medicare correctly, so there are no gaps and no penalties. When you eventually do leave your job and lose your employer coverage, you have what's called a special enrollment period to sign up for Medicare, and that window is 8 months. The 8 months starts the day your employment ends, or the day your group health coverage ends, whichever comes first. It does not start when you file for retirement. It does not start when you turn in your paperwork. It starts when that coverage actually stops. Here's the most important thing about that window. You want to apply for Medicare 2 to 3 months before your employer coverage ends, not after. If you apply right as your coverage is ending, you can usually line things up so there's no gap in your coverage at all. And there is one more critical thing you need to know about that 8 months, and we're going to talk about it right now in the next section. If you find this information helpful, please like and subscribe to stay updated. For personalized assistance, contact Loran Marms at the Medicare Solutions team at 920-545-4884. This is the mistake I see more than any other, and it's the one that costs people the most money. When you leave a job, your employer is usually required to offer you what's called COBRA continuation coverage. COBRA lets you stay on your former employer's health plan for up to 18 months, sometimes longer, and you pay the full premium yourself instead of having your employer cover part of it. Here's the problem. A lot of people think that being on COBRA is the same as being covered through an employer, and therefore they can still delay Medicare. That is not true. COBRA is continuation coverage, not active employer coverage. Medicare does not count COBRA as qualifying coverage for delaying enrollment. What that means in practice is this. Your 8-month special enrollment period starts when your active employment and your employer group coverage end. It does not pause or extend because you signed up for COBRA. The clock is already running. If you spend the first 4 or 5 months on COBRA thinking you're protected and then realize the mistake, you may have already burned most of your enrollment window, and every month you go without signing up is a month that counts toward a permanent penalty. COBRA can make sense in some situations, but it should never be your plan for handling Medicare. If you're approaching retirement, call us before you decide what to do with COBRA. We can help you figure out what actually makes sense for your situation. Let's talk about what happens if you miss your window without qualifying for a special enrollment period. The Part B late enrollment penalty is 10% of the standard Part B premium for every full 12 months you were eligible but didn't sign up. And this penalty is not a one-time fine. It is added to your monthly Part B premium for as long as you have Medicare. For most people, that means the rest of their life. The standard Part B premium in 2026 is $202.90 per month. If you delay enrollment by 1 full year without a qualifying reason, your premium becomes $223.19 per month permanently. 2 full years of delay, and it becomes $243.48 per month permanently. And here's the part that makes this even worse. The penalty percentage stays the same, but the base premium it's calculated on goes up every year. So as Medicare raises premiums over time, your penalty in actual dollars gets bigger too. The good news is this penalty is completely avoidable if you understand the rules and act on time. That's exactly what this video is here to help you do. If you have a health savings account through your employer, there is a rule you need to know about before you sign up for any part of Medicare, and it catches people off guard regularly. Once you are enrolled in any part of Medicare, including just Part A, you cannot legally contribute to a health savings account, not a single dollar. The IRS rule is very clear on this. It does not matter whether your employer is still contributing or whether your health plan is still eligible. Once Medicare starts, the HSA contributions have to stop. Here's where it gets tricky. Medicare Part A has a 6-month look-back period. If you sign up for Medicare after age 65, Part A can be backdated up to 6 months. So if you apply in September and Part A is backdated to March, any HSA contributions you made between March and September became a violation of IRS rules, and you'll owe taxes and penalties on those contributions. The safe move is to stop all HSA contributions at least 6 months before you plan to enroll in any part of Medicare. If you're planning to stay on your employer plan all the way to retirement and you're thinking about Medicare timing, this is something we need to talk through before you make any decisions. Part D is Medicare's prescription drug coverage, and it also has a late enrollment penalty that works a lot like Part B. As long as your employer's drug plan is considered creditable, meaning it covers medications at least as well as the standard Medicare Part D plan, you can delay Part D without any penalty. You don't have to do anything to figure that out or call anyone to check on it. Every September, your employer is required to mail you a notice called the Notice of Creditable Coverage. It comes to you automatically. Keep that notice. As long as it says your coverage is creditable, you're protected and there is nothing else you need to do. If the notice says your coverage is not creditable, that's when you need to take action. Call us right away because you'll need to enroll in a Part D plan before your window closes or the penalty clock starts running. The Part D penalty adds 1% of the national base beneficiary premium for every month you went without creditable drug coverage. And just like the Part B penalty, it's added to your monthly premium for as long as you have Part D coverage. This one is specific to people who started collecting Social Security benefits before they turned 65, and it catches a lot of people by surprise. If you're receiving Social Security retirement benefits when you turn 65, Medicare enrolls you automatically in both Part A and Part B. You get your Medicare card in the mail, and both parts start on the first day of the month you turn 65. For most people, that's great news. But if you're still working for a large employer and you don't need Part B yet, you don't want that enrollment to happen automatically because Part B has a monthly premium of $202.90, and you may not need it while you're still fully covered at work. Here's exactly what to do. When your Medicare card arrives in the mail, flip it over. The instructions for declining Part B are printed on the back of the card. You sign the card and mail it back, and that tells Social Security you want to delay Part B for now. You'll keep your Part A and you can enroll in Part B later using your special enrollment period when your employer coverage ends. If you miss that and Part B starts without you intending it to, call Social Security as quickly as possible because there is sometimes a limited window to undo it. I want to be clear that I'm not criticizing HR departments. The people in those roles work hard and they know your company's benefits inside and out. But Medicare is a federal program with its own rules, and those rules don't always match what an HR team is thinking about day to day. There is really one question worth asking HR directly, and that is whether your specific plan requires you to enroll in Medicare at 65. Some plans do require it even when the employer has 20 or more employees, so it's worth asking once. That's a company plan question they can actually answer. On the drug coverage side, you don't need to involve HR at all. Your employer mails you the notice of creditable coverage each September automatically. Keep it. As long as it says your coverage is creditable, you're done. For everything else, Medicare enrollment rules, how COBRA interacts with Medicare, penalty timelines, what happens when you retire, those are Medicare specialty questions. I've had clients follow HR's well-meaning advice on those topics and end up with permanent penalties because the answer HR gave them was wrong. Not because HR was careless, but because Medicare rules are a specialty that most HR teams don't deal with every day. That's what we do. If you have any questions about how your situation works, call us at 920-545-4884 before you make any decisions. Let me bring it all together into 3 things you can do right now if you're approaching 65 and still working. First, find out your employer's size. Call HR or look it up. If your company has 20 or more employees, you have options and flexibility. If it's under 20, you need to enroll at 65 and call us. And if your coverage comes from a spouse's employer, that same 20 employee rule applies to their company. Second, keep your notice of creditable coverage when it arrives each September. Your employer mails it automatically. As long as it says your drug coverage is credible, you're protected and there is nothing else you need to do. Third, before you decide to stay on your group plan, call us and let us do a real comparison. Premium versus premium, deductible versus deductible, maximum out of pocket versus maximum out of pocket. For some people, the group plan is clearly the right call. For others, Medicare plus a supplement is actually cheaper and better. You deserve to know which situation you're in before you make that decision. If you've made it this far in the video, you already know more about this situation than most people turning 65, and that knowledge can save you real money and a lot of stress. The next step is simple. You can take the free Medicare Clarity Quiz at the link in the description. It takes about 2 minutes and it gives you a personalized result based on your specific situation. Or you can call or text me directly at 920-545-4884. I'm happy to talk through your situation, compare your numbers, and help you figure out exactly what to do. And if you would like to set up a free appointment, the link is in the description below. There's no sales pressure here. I built my business on giving people straight answers, and that's not going to change. If staying on your group plan is the right move for you, I'll tell you that. If Medicare makes more sense, I'll show you the numbers and you can decide. Thank you, and we'll see you in the next video.